Many people are candidates for dermal fillers. As we age, we often lose volume in our face, and dermal fillers, as the name implies, will fill out hollows, depressions, and wrinkles. So this actually makes it wide open for many of our patients who have issues with facial aging to become candidates for dermal filler. And this means not only off-the-shelf commercial fillers, but fat, your own fat, is a filler, and it's the most natural filler you can have. We remove fat from one area of the body and put it into another area, sort of robbing Peter to pay Paul. Many areas of the face, or indeed other territories of the body, can be injected. In fact, essentially any territory of the body that has a volume deficit can have fillers placed, and I'm talking here again about the concept of not just commercial off-the-shelf fillers, but your own fat. What we use fillers mostly for is in facial volume reconstruction or rejuvenation. We're talking about tear troughs, hollows in your cheekbones that have gone south and sagging and have lost volume. What we call atrophy, when the fat, your own fat, melts away and you need more volume to regain that volume that you had when you were younger. The side effects are usually minimal. The worst side effects frequently are simply the bruising, because when you do multiple needle sticks into a territory, inevitably you're going to stir up at least a tiny amount of bleeding, and that's right next to the skin, so a great deal of the patients will bruise for a short period of time. These injections can last variable periods of time depending on what type of filler is being used. Different fillers have different lifespans. The lifespans generally are from 6 to 8 months all the way out to a year and a half, or in the case of one particular agent that technically is not a filler, but it's more of a stimulant, it can be about a 3 or 4 year lifespan. So they can be considerable length to even the off-the-shelf fillers. Now when you're talking about fat, since this really is a fat graft, this can be a lifelong filler effect depending on how well it takes.